We have a special presentation. It will be an interesting talk, not presentation, by Shri Ranjan Kumar IAS. He's the Secretary of Medical Health and Family Welfare Department, Government of Uttar Pradesh. Why is it's an important talk? Because this topic is quite interesting. And I'm sure not much work has been done on this front in this country. That is urban healthcare when you talk about the from the policy making perspective. Uh, Making urban healthcare a priority and ensure sustainability to counter challenges of rapid urbanization. If you read the World Bank report or the WHO report, they have a huge focus on urban health. And maybe Sri Ranjan Kumar sir can enlighten us on his vision on how we can focus more from the policy perspective on urban healthcare. So over to you, sir. A huge round of applause for Mr. Ranjan Kumar. Can you please come on stage, please? I request Mr. Venkat Garimela from Shiny Lake, India to come on stage and welcome Mr. Ranjan Kumar with with a plant. We talk about sustainability, so let's give him a plant as we welcome him on stage, please. Thank you so much. Thank you so much. Now I request Ranjan Kumar to deliver his special address on this very important topic on urban healthcare. Over to you, sir.
Thank you. Thank you so much. It's very interesting topic and the conclave on such emerging issue. This will definitely benefit everyone, the stakeholder from industry and the government also. We are always keen to participate in such conferences and conclaves so that we can move forward with new innovations and other things. As we know, in coming years, most of the people would be living in the urban landscape. The currently 55% of the world population, they live in urban areas, and that is expected to increase to 68% by 2050. So this is definitely a challenge for policymakers and people themselves, how to manage the affair of urban sector, because that require a lot of planning and foresight, vision, and definitely sustainability is a word we use very often nowadays. That, from my point of view, is basically if you plan for today, it should sustain for future also. So scalability should be issue that itself call for so many insight on so many issues. So when we talk about the urbanization now is identified as engine for growth because more people living together, so they see opportunity for employment, for their role in economic growth as in form of different responsibility, maybe as an entrepreneur, maybe as a financier, or maybe using as a skill and all. So all the institutional setup is such in the urban area that you can easily test your caliber to fit in some of the sector of urban development. So definitely it's going, there is no saying on this key, there is other option that urbanization for the fastest economic growth. But this brings a lot of challenge, how to manage this, the air pollution, the transport problem, and management of this housing and many other issues. So in any of the society, all the people from all ages, they live together, and they expect from the policymakers and all their friends and their neighbors, to give them the clean environment, because they have a natural right to grow and learn in best eco system or environmental system. So they need good greener spaces and good bluer spaces. Also, with age, you have different limitations. You grow with limitations, so you expect community will support you. So, when we talk about rapid urbanization, I see that we talk about making the current infrastructure more efficient by integrating the technology, mostly the software. The rapid transformation started from 90s, the over-the-top things, Internet of Things and other things. AI and other. So that is basically improving the efficiency and improving the optimal use of infrastructure and all. But the concept of life is somewhere missing. So if we talk about green and blue spaces, so in the urban sector, you are supposed to work hard to rise, because the environment is such that easy transportation and easy availability of different employment opportunity. You can be mobile. If you see another opportunity, you can move there. So that demand more work, more stress. So you have mental stress day and night. But if you live in an environment where only buildings are there, you have no space for relaxing, or you're getting exposure to pollution and other thing, so that definitely harm your mental health more. So if you have good mental health, then you can think better, you can express better, and also at the same time, you can connect to others much better. So the ability to connect others, so making a good society, that making ease of understanding how to move together. Like in Corona times, the issue was not individual hygienic issue or individual health, it was community health. So we were more concerned about others, that you should live healthy, you should be more concerned about your own health, so that we all are protected. We have developed, as a government, we are working hard to expand our infrastructure. We have developed more than 21,000 health and wellness center. This is a new concept where we have more than 14 lab test facilities, more than 59 drugs are available. Now there is a community health officer with A&M also. So earlier it was not very much active, that some sectors. Now this is very active health facility. Also at the same time, we give facility of teleconsultation also. We are using technology also. So through e-Sanjeevani. So health and wellness center is basically at the 5,000 population level. So definitely you reach to the village level with such high level of facilities. But people coming with the disease, so our capacity to diagnose why this disease, and the capacity to monitor and prevent the factor which give rise to this disease is definitely require lot of thinking on that, how to understand those factors which do not require medicine but preventive approach. Because if you see the government facilities, this PSC, CSC, we are supposed to more into the community health, we are more into the preventive thing. Clinical, we are providing clinical facilities in district hospitals. Now we are equipped, well equipped with CT scan and MRI. Now we are coming up with the MRI facility also, the blood testing facility, the very high tech, the state of the art at very district and sub district level also. So we are providing the facilities, but we are more concerned about communicable disease. We are more concerned about how to prevent the spread of disease in the masses, how to make people more healthy and live a good life. So that area is now, that focus is diverting into the urban area because we are growing very much faster rate. So in the urban area, there are challenges. In the rural area, our Asabau, they reach each and every household. They do good survey. They have good communication with the people, and they have done tremendous job during Corona. I have seen they were so much technically sound that they can fill up good questionnaires, and they were taking decisions on the basis of data. So evidence-based decision they were taking, and that definitely uh, enabled us to cover 100% people with limited resources, because they were the main pillars. So in the rural area, you have access in the form of ASA and other rural, the village level workers. But in the urban area, it's very, very challenging. If you try to go and conduct open meeting in the ward, hardly people are coming up. And if you want to go into the building, so there are a lot of resistance. So meeting people in urban landscape is big challenge. So definitely I will look forward and towards the urban planners. While you do a lot of planning and land use design and making policy for better utilization of land and other thing, I will put the perspective in the form of like, what do you think about the people who are disabled, like having dementia, or the society, the sector like women and child, they are vulnerable to natural disasters and other exposures. So how do you plan for them? How do you produce environment in all the sector, like transport sector, your bus stand, and your technology and other thing, safe environment. So definitely we need to see that there should be the binding role and action, expectation of action from players who are bringing urbanization. If you look at the greener space. So if you have not planned that every mohalla have a good greener space, and they fit into the local environment, like types and character of greener space cannot be fixed. It has to be evolving. So there are a lot of finding where they say that shrubs and dense forest sometimes is impacting negatively on the community health. So you need to think about local need of this greener space. So I don't think the much work has been done in this designing of greener space. I have read many times that there are many more than 100 types of greener spaces that can be designed and think of. What about bluer spaces like the water thing? So in urban sector, to define these ponds and this watershed and other thing is so challenging, because sometimes you see in the morning that yesterday it was a pond, now there are buildings. So it's very fast paced, and the kind of structure to monitor and prevent these things is not very effective. So definitely, if you look at the planning, it should be integrated into that, and we need to look towards players like WHO and the agency associated with different initiative from the WHO. There are a lot of research and data available. They talk about these things, about types and character of these green spaces. They have different examples all over the world. So how to take note of those things? Do we have the integrated approach that we should chip in on those reports and evidence? Similarly, if you look at the e-waste, so we talk about waste management in urban sector, but the data says that is available for 2019 that only 17% of more than 39 million ton e-waste generated is taken care of. They are recycled in a manner, environmentally clean manner. But what about 83%? They are either being picked up directly by the children and women, or they are shipped, transported to the country with poor income and those areas where that is useful. And there, the children and women, they used to extract metal from e-waste. So it is now proven a fact that this is very dangerous. To extract metal informally is very hazardous for the health of the children. At the same time, they are at a tender age and they are in a very vital stage of their development. So immediately that affects their development. Also, where they are susceptible to acquiring infection and other things. So these exposures. So what about the right of children to grow and learn in a good environment? What about that? They are being exposed by missed action or a lack of binding action on the players who are involved in these waste generation. So we have to tell them, the exporter, importer, or the people handling these big the technology based these chips and other thing, that they should take care of these management. Why only 17%? So we have to see that on the resource itself, we have to bind actions. So we have to integrate penalty based something that is required. Also, we talk about developing different interesting spaces in the urban area, like the space for walking, cycling. So there are reports now that we can use of research already happening about if you spend, if you walk X kilometers, so your chance of mortality will reduce by such. So this will definitely make an issue in the community that walking and cycling is a must. We have to be involved in the physical activity. So these things should be integrated in our advocacy. We conduct different programs and IC and other thing. So we should advocate for these kind of evidence-based assessment. If we look at non-communicable disease, we have very high-tech now unified disease surveillance platform in UP. We have utilized the knowledge and wisdom of CoWIN platform, where everyone was accessing our platform to get lab report of COVID. So we have improved and expand to the more than 14 notifiable diseases. We have notified 2-3 more diseases now. This is binding on everyone even private health facility to notify their disease. So we are now, we can see that the geographically in UP where the incidence is more, and immediately outbreaks are notified and we send our team, immediately we respond, and that is integrated in the portal itself. So that is helping us. But I am talking about the new approach of managing these NCD. So there are research where they are integrating now the key behavioral risk factors. So what is the impact of tobacco use? What is the impact of alcohol use, physical inactivity, unhealthy diet, adverse key biological risk factors like overweight and obesity, raised blood pressure, raised blood glucose and abnormal blood lipids, and etc. So if we integrate into the health system through the urban stakeholders, can we talk about these in real sense, that these are the factors which is affecting your non-communicable disease. So this will reducing your the life expectations. And these are the things you can do. You can go and walk in the park and use our the clean blue spaces and other things. So we need to think about these are happening. The entrepreneurs and good researchers are doing a lot of work on this issue. So definitely we are uh, maybe on the initial step in these things. So if you look at the people with dementia, are we thinking about them? Like for the women, you need to have the button in the buses, the CCTV facility where they are stopped. There is very secure places because their requirement is different from others. They need to take care of their children. They need to take care of their work spaces. So there are so many, they move frequently on the buses. So they require different kind of environment. So can the urban planner can provide these environments? Similarly, for people with dementia, can we create a new world for them? Like in HIV, we created clubs where the people with similar incidents, they are more close and they can more frank to each other. That provided lot of empowerment to those groups. They do a lot of advocacy now. Similarly, can we create some urban system where it is dementia free friendly initiatives we can take? Similarly, for the older people, for age friendly, we need to think of so many things. How to utilize their ability. Suppose you do not provide a system where they can easily transport to one place to another, so they will be confined to their home. Can we provide? So we are not utilizing their skills. I have seen in Lucknow, I visited one house where she complained about some young people are making surveillance of her house for a different mensaria. So I visited her house. So she was so knowledgeable. She has done a lot of research on so many things, but nobody was interested in her. So can we utilize their resources, their wisdom? Can we provide such system in the urban sectors? There are so many issues related to pollution, the air pollution and other things which are affecting our life. So what I am trying to say that the government is spending, they improving the expenditure, and expenditure, if you see, that is growing year by year. And we are definitely bringing through Pradhan Mantri Jan Arogya Yojana, bringing the cost down for the your disease cost. But it will not reach us to the level which we want, that healthy and enjoyable life, stress-free life of the whole community. We should live in a different world. Definitely, this kind of approach will improve the possibility of rapid urbanization and possibility of urban sector becoming the center of economic growth in real sense. And we require at this juncture more than anything else, like we need to think about the comprehensive approach of urbanization with health as a main center of thinking. Thank you so much. Thank you.
Thank you so much, Sri Ranjan Kumar, Secretary Medical Health and Family Welfare Department, Government of Uttar Pradesh. And when I introduced him, I said that there are a lot of space are there where we can think of urban healthcare according to the World Health Organization report or the World Bank report, especially for developing countries. And sir has rightly touched the right chords that where we can focus. Mental health, obviously, a very important issue. Uh, I think in some of the aspects of smart city, if you read the mission report, also they have focus on creating greener spaces, environmental friendly spaces that can also reduce some of the stress of the people and for the aged people also. In that World Health Organization report, they also mentioned about the special focus for children and the aging people. What can we all do about that? So I think these are all interwoven with the SDG goals as well. So I think sir has tried to put all those things at the very core of the discussion. Thank you so much for that. I request Ms. Neha Pal, um, Head Healthcare Division, APAC News Network, to come on stage and hand over a speaker memento to Mr. Ranjan Kumar, Secretary Health, Government of Uttar Pradesh. Huge applause for him, please. Thank you so much, sir, for joining us today.